Hi, my name is Dr. Ilya Skolnikoff, and I'm excited to be here today sharing with you a few things about weight loss. I run the Triad of Health Family Weight Loss Clinic in San Rafael, and what I've noticed over the last decade or so that we've been helping people with weight loss, and we've had excellent results helping people with weight loss, if you don't mind me kind of tooting my own horn here. What I've noticed is that not a lot of healthcare providers really get to the underlying causes of the person being overweight. And they don't understand the science of it. See, weight loss isn't some fad thing. It's not something where you can go to Jenny Craig or Weight Watchers or Slim Fast, or you can start taking a pill or a potion or a lotion, or you can change your diet, or you can see a specialist, or you can do a tummy tuck, or get the perfect surgery, or find the perfect drug, or take the perfect pill, or do the perfect diet, or use the perfect potion or lotion, or just do the perfect exercise at the gym. And I mean, that's not really what allows a person to have permanent weight loss. I hate to burst in your bubble here. I hate to be the one to tell you this, but permanent weight loss means getting healthy. Permanent weight loss means getting all the systems of the body in balance. Permanent weight loss is about never having to worry about having a fight near a refrigerator or walking into a refrigerator kitchen landmine again. Permanent weight loss is not about walking past the donut. It's about not wanting to eat the donut at all because you just don't find it appealing. Permanent weight loss is not about anger, irrationality, frustration, aggression, depression, or being upset or pissed off or annoyed or irritable or jealous or sad. It's not about that. Permanent weight loss is about being happy. Permanent weight loss is about being excited. Permanent weight loss is about having all of your systems in balance and being able to really be at your peak. And the way to do that is to find a healthcare provider who understands how this weight loss thing works. And so, who would that healthcare provider be? Let's take a look at this seriously. So if you're thinking you're going to find her, so first of all, what if you don't find a healthcare provider? What if we just go with the perfect book that teaches you how to lose the weight, maybe written by a famous movie star or something, like Suzanne Summers, because Dr. Summers, oh, that's right, she's not a doctor. She knows what she's talking about, though. So let's say we found a doctor, like Dr. Barry Sears, or like Dr., any doctor who wrote any book on weight loss. Dr. Atkins, Dr. this, Dr. that. I have a question for you. Have you ever met that person? Have they ever examined you? Do they know what's causing your excess weight? Do they? Do you? Have you? Did you get the exam done? Did you? Do you know what the cause is? Is what's causing your excess weight the exact same thing as what's causing everyone else's excess weight? Is excess weight just a commodity? If you want to get weight loss, is it a commodity? Can you just go to any old doctor and get the results that you're looking for? See, if I was struggling with my weight, and I have before, but it wasn't a serious issue for me, I'll be honest with you, but I had a little trouble with my weight. I wanted somebody who could do three things. I wanted somebody who could tell me exactly what was causing me to have extra weight, exactly how to get rid of the weight, and how to get the weight to never come back again unless at least, at the bare minimum, at least I would know what was causing the weight. So here's what the other healthcare providers don't know that I seem to understand fairly well. And again, this isn't meant to point a finger or anything like that. It's just meant to be kind of like, let's get down to the facts, let's talk bare bones, let's get down to business, let's not screw around, let's be serious with each other, okay? What do we look at with weight? We got to look at a couple things. When we smell the food, does the first mechanism of digestion work? Can we start to salivate? Can we start to get the parotid and the salivary glands and the sublingual glands to put out the ptyalin and the amylase and a few of the other enzymes that are needed to start to break down the food in the mouth? When we then take in the food, do we chew properly? Are we chewing 25 or 30 or 35 bites per, times with each bite of food or 2 bites of food? I'm not saying that that's always necessary for weight loss, but, let's talk serious physiology and serious medical fact here. That's going to help to break down the food, to tag the food with the proper substances that allows your body to know what it is that you're eating and swallowing, so that it can have the right gastric production and the right kinds of digestive enzymes and whatnot to break down the food, and then to be able to absorb it later. So what's going on next? Next, we need to have healthy teeth, right? We need to swallow the food, and then we need to break down the food in the stomach. Right after the esophagus goes into the stomach, did you know that 75 or 80% of digestion happens in the stomach? Yeah, so, when my patients are overweight, I'd say maybe, well over half of them are having trouble with their stomach. Their stomachs aren't working properly. And so we need to have a few things happening in the stomach. You can't make hydrochloric acid without zinc. If I'm boring you, hey, what do you expect? I'm a doctor. You knew it was going to be boring. You got yourself into this mess. You pressed play on the little thing there. So, we need to understand the physiology, right? We need to understand how the hydrochloric acid is made. If we don't have zinc, we can't make hydrochloric acid. If the stomach's not functioning right, the person's likely going to have troubles with B6, B12, and folic acid. That means that they can't methylate properly in their liver. That means that they're going to have other toxins building up in their system. Not to mention the fact that they're liable to be anemic. And if they're anemic, they're tired. If they're tired, they don't have enough energy. If they don't have enough energy, they don't burn enough fat. So anyway, these things are all really, really, really important. Other things to keep in mind. There's a few glands and organs that really help with fat metabolism. Those are the pancreas. Those are the small intestine. Those are the colon is going to detoxify the last bit of bolus of food before it leaves the body. Okay, so there also is the thyroid, has to do with energy production and fat metabolism, as does the gallbladder, which makes the bile. That stores the bile that's then squirted into the small intestine that then emulsifies the fat. The liver makes the bile that's sent to the gallbladder. The gallbladder holds the bile. The gallbladder then shoots the bile into the common bile duct, where it mixes with pancreatic juices. And if the stomach didn't tag the food that it was digesting, especially if it's protein, with enough stomach acid, then it won't signal to the pancreas to release CCK, and to put the CCK, cyclocystine kinase, into the small intestine to break down the food properly. So there's this whole chain of events that takes place. And if you're a licensed healthcare provider and you're helping your patient with these things, wouldn't you want to know about that stuff to help your patient? I think you'd want to know. So thanks a lot for listening to this episode of Permanent Weight Loss from Triad of Health Family Healing Weight Loss Center. And we'll look forward to seeing you soon.